Hey guys, my name's Aaron with Ross Training Academy. I am a nationally registered paramedic. I've been doing this for about 6 years now, and today we're just going to be talking about BLS CPR. Now, before we get into CPR, I think it's important to differentiate between a cardiac arrest and a heart attack. A lot of people use these two words kind of interchangeably, but they do mean completely different things. A heart attack can lead to cardiac arrest though. So let's talk about a heart attack. So a heart attack or a myocardial infarction, this patient is going to have some chest pain right in the center of their chest. They might describe this as a crushing chest pain. They might also have some left arm pain, left-sided neck pain, left jaw pain. They might even be nauseous. They might have some vomiting going on as well. These are all going to be signs of a heart attack. This person will be conscious, they will be breathing. They'll be able to talk to you. They might be able to have a conversation with you. The way we're going to treat this is we are going to administer 324 milligrams of chewable baby aspirin, and you want this patient to chew up that aspirin. You don't want them to swallow it with water. They're going to chew up this aspirin. You're going to call 911 and get the ambulance started and coming on the way. Now, a cardiac arrest, on the other hand, this person will be dead. They will be unconscious, unresponsive. They will not have a pulse, and they will not be breathing. This is when CPR, BLS CPR, is going to be indicated. So the way to check their level of responsiveness, we're just going to do what's called the tap and shout, and all that is we're going to tap them on the shoulders, and we're going to yell, just, "Hey sir, can you hear me?" Now, most times that's not going to work. That's not really going to wake anybody up. So what we're really going to do is we're going to cause some painful stimuli, and the way to do this is we're going to take our knuckles here and we're going to dig it right into the center of their chest, right onto their sternum, and we're going to try to cause some pain. And so we're just going to dig it in, we're going to shake them around a little bit, use our knuckles right on the sternum, and the goal is to kind of hear some type of groaning, see the patient grimace, maybe even smack you awake. Now, if the sternal rub didn't work, we can try to pinch their traps, see if that's going to cause some painful stimuli. But if they didn't respond to the sternum rub and they're unconscious, what we're going to do is we're going to go ahead and we're going to feel for a pulse. Now, we're going to use our two fingers and we're going to place them right where the neck and the jaw meet, right into that crease. And we're going to go ahead and we're just going to hold our fingers there, our two fingers there, put some relatively firm pressure down to that area. And we're just going to hold it there for no more than 10 seconds. While we're doing that, we're going to be looking at the chest, looking at the stomach, and looking for chest rise and fall, looking for breathing. We can also get our ear close to our person, our patient, and listen for breathing as well. Now again, we're going to do this for no longer than 10 seconds. If we do not feel a pulse, and we do not see or hear breathing, or we're questioning if we're seeing or feeling these things, we're just going to go ahead and we're going to start doing our CPR. But first, we want to go ahead, pick people out in the crowd that you're with, and just, hey, go get an AED, you over there, call 911. You want to get those two things started as soon as possible. Now, we're going to start our CPR. The way to do CPR is we're going to take the heel of our hand and we're going to place it right into the center of the patient's chest, right onto their sternum. And to find how high or low to go on the chest, I always put my right hand down and then I use my middle finger or my ring finger and place that right at about the nipple line, and that gets me to about the right height on the chest to do my chest compressions. So we're going to go ahead, put the heel of our hand right down into the center of the chest. We're going to lock out our arm, lock out our elbow. We're going to take our other hand, we're going to wrap it right over our down hand, wrap our fingers around just like that, lock out both arms, center of the chest, and then we're going to pivot at the hips. And you want to push down about 2 to 2.5 inches for an adult. And you want to do this pretty fast. You want to do this 100 to 120 times a minute. There's a few songs that we can use to like keep that rhythm, keep that rate. And this is just going to be like Staying Alive is one. If some people are familiar with the song Baby Shark is another good one to keep that tempo. A really fun one that I recently found out is going to be WAP. WAP by Cardi B, and that also keeps the rhythm. So again, we're just gonna get our hand placement right, I don't believe I said this, but you do want your person to be laying down on the floor on a hard surface. If you can't get this person down on the floor and they're laying in a bed, try to get a board underneath their chest, just so that you have something hard to compress against. So let's get our hand placement right, and we're going to pivot at the hips, go down about 2 inches, and then come back up, let the chest fully recoil, go back to its normal position, and then we're just going to keep doing that. So this is what it's going to look like. Alright, so that's about as fast as you're going to go. That's about the tempo that you're going to have. And you're going to get your 100 to 120 chest compressions a minute, and you're going to use a ratio of what's called 30 to 2. And what 30 to 2 is you're going to do 30 chest compressions followed by 2 rescue breaths. There's a few different ways to do your rescue breaths. A real basic, simple way, kind of gross way, is to put your mouth onto their mouth. And the way we're going to do this is we're going to do what's called the head tilt chin lift. So we're just going to push their forehead down to the ground, lift their chin up to the sky. We're going to pinch off their nose, pinch off their nostrils, and we're going to wrap our lips around their lips. That's pretty gross. A lot of people in cardiac arrest will have vomit coming out their mouth, will have blood coming out their mouth. It's up to you if you're going to put your mouth on that mouth. Yeah. So, some other ways to give your 2 rescue breaths is you might have something like this, just a little pocket mask. This will be like a little keychain pocket mask. All it really is just like a little plastic bag. It costs a couple dollars. You'll probably see it with the AED. And it's almost like a surgical mask. You'll wrap it around the patient's ears here. It has a one-way valve right in the center. And so it's still pretty intimate, but you have some type of barrier to deliver your breaths. So you'll place it down, wrap the loops around the ears, pinch off the nose still, and now you can do your rescue breaths over the bag. So that's one way to do it. You might see something like this. This is a different type of pocket mask. So this is what it'll look like. You'll pop it open and you'll see something that looks like this. All you're going to do is you're going to pop it out. It'll have a filter in there, just so that their spit and throw up can't come out and into your mouth. And then it has a one-way valve in it, just so that you can breathe in, but they can't breathe back into you. And the way we're going to use something like this is we're going to use what's called the CE method. And it also has a little strap to wrap around the head. So you'll wrap it around their head, secure it, and then you're still going to use your CE method. Now, what the CE method is just your hand placement, how you're going to have your hands. So this shape here, this is just going to be your C shape, and then these 3 fingers are just going to be like your E. This is going to be your E shape. So you're going to take your mask, you're going to have this narrow part up over the bridge of the nose, and then this wide part down on the chin. You're going to take your CE, place it right on top, just like this. You're going to place that mask right over the bridge of the nose, over the chin, put your C right on top of the mask, get a nice firm pressure down, but what we really want to do with our E is grab the chin and lift it up into the mask, and that's how we're going to create a good seal. So we're going to lift up, have a nice pressure down, lift up, do our 2 rescue breaths, and then we're going to go back to our 30 chest compressions, and then we're just going to bounce between those 30 to 2 for the rest of the resuscitation attempt. And then another device that you might see for breathing will be something like this. This is going to be called a BVM, or a bag valve mask, or an AMBU bag, just depending on where you work, what terminology you guys use. If you work in healthcare, you're probably really familiar with this. It attaches to an oxygen tank, and then this reservoir bag fills up with oxygen, and then you just squeeze this bag to deliver the breaths. It still has like that little mask on it, and you'll still use your CE method, and you'll still place it down, lift the chin up, do 2 breaths, and then back to chest compressions. When you're doing your breaths, either with this bag or with your mouth in some way, when you give the breath, all you're going to do is you're going to look for chest rise and fall, the patient's chest to rise and fall with each breath. As soon as you see the chest rise, you're going to stop delivering the breath. You don't have to sit here and wring this bag out into the patient. Just a nice little squeeze, just enough to see that chest rise and fall. You don't want to pop their lungs. So now we're going to go ahead and we're going to assume that our AED showed up. Our automated defibrillator, our automated external defibrillator is what AED stands for. So it'll be something like this. Most of them are going to be a little bit bigger than this, but they're all going to function pretty much the same exact way. They're going to have 2 buttons. Some of them have 3 buttons. The first button is going to be this green button, and that's just how you turn it on. You're going to press and hold that for about a second or 2, turn the defibrillator on. This button down here is going to be the shock button. It's going to be an orange button with like a lightning bolt in it. You can only shock somebody when the AED says that you can. You can sit here and just spam this button, click it as much as you want, and it's not going to do anything unless the AED is ready to shock this person. The AED can only defibrillate 2 heart rhythms, and that's going to be VTAC and VFib. Any other heart rhythm, it will not defibrillate. You might hear the AED say some sort of prompt after your rhythm check, and it'll say something along the lines of, no shock advised, resume CPR, or it might say no shock advised, CPR not indicated, or something along those lines are the 2 things that you might hear. Or you might hear shock advised, and then it'll give you the prompt of what to do then. These AEDs, they're really smart. They come in handy. The first thing that you do when you get them, turn it on. It'll tell you exactly what to do. With this one here, because I know how it works, I know that it wants us to get the pads on first. So let's go ahead, let's just look at the pads real quick. So AED pads, they're going to look something like this. These are going to be adult pads. You also might see some pediatric pads. Pediatric pads can only be used on pediatrics. They cannot be used on adults, whereas adult pads can be used on anybody. So a lot of AEDs will probably just have 1 or 2 sets of adult pads only, and that's okay. You don't got to worry about overshocking the child. The AED will sense the resistance through the body, and so it won't deliver a huge shock meant for an adult to a kid. So you don't have to worry about hurting the kid, burning the kid, nothing like that. On all AED pads, they're going to have little pictures on them, little diagrams, and they're going to show you exactly where to place these pads. One pad is going to go on the upper chest below the collarbone. So you do, at this point, want the patient's shirt to be off. If they're wearing a bra, you want that bra to be off. If they have any necklaces on, you want to take those necklaces off or at least move them out the way. So you'll take the one that goes on the right upper pec, place it right on the upper pec below the collarbone. And then the other one here is going to go down on the lower ribs, right below that anatomical nipple line, or where the breast crease is over. So that breast crease is going to be like that anatomical nipple line. And then you'll just place one right on the side, right on the left side, left lower chest. So, one, you'll take off the protective film from the little sticky part, and you'll just place it on there nice and firm. The other one, you're going to place it right on the upper chest. So now that we have the pads on, we're just going to go ahead, turn our AED on with this green button right at the top.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light.
This little connector here, we'll go in, plug it in right there.
Analyzing heart rhythm.
So, clear the patient.
Do not touch the patient.
Don't touch the patient.
Shock advised.
Okay, so everybody clear.
Charging. Stay clear of patient.
Everybody clear.
Deliver shock now. Press the
Deliver.
orange button now.
So everybody clear. We're going to shock.
Shock delivered. Begin CPR.
And we're just going to start our CPR. Turn this thing on. It'll tell you exactly what to do. So you don't have to think anymore. You don't have to remember your song either, because now there's going to be a little metronome there at the end. And it'll tell you your rate to do your CPR at. Let's see. The AED is going to have that little metronome going for 2 consecutive minutes. After that 2 minutes is when you're going to stop, feel for a pulse, listen to what the AED says, and then we're going to go from there. Every 2 minutes, you want to also switch compressors. So if you have help, every 2 minutes, get somebody else in to do your chest compressions, or it'll be every 5 cycles of that 30-to-2 ratio, or if you are just so tired to where you can't keep doing your chest compressions, they are not effective anymore, go ahead, stop, switch somebody else in, and let them do the chest compressions. So that's basically just BLS CPR for an adult. Now, let's talk about kids, adolescents, pediatrics. This is going to be anybody from about 1 year old up to about 15 years old, or 1 until puberty age. And to find out if somebody has hit puberty, you're going to look for facial hair, armpit hair, groin hair, and then breast development in women. Those are all going to be signs of puberty. If you do see signs of puberty, you're then just going to treat them like an adult. But we don't see puberty. They're between that 1 to 15 years old. Basically all the basics of CPR are going to stay pretty much the same. You're still going to go down now you're going to go down, your chest compressions are going to be about 1.5 to 2 inches. 2 inches is more on that like preferred size as they start getting larger in size. And you want to still allow for full chest recoil. You're still going to go 100 to 120 chest compressions a minute. If you are by yourself, you're still going to do that 30-to-2 chest compression to breathing ratio. If you have some help, so it's me and you working on this patient, now we're going to do 15-to-2, 15 chest compressions followed by 2 rescue breaths. The reason we do this is because pediatrics and adults go into cardiac arrest for separate reasons. Pediatrics tend to go into cardiac arrest for respiratory issues, whereas an adult typically goes into cardiac arrest for a heart issue. So we're just going to go ahead and prioritize 2 different things for the different age groups. You can still use the same exact things to breathe for the patient. You can still use something like this if the patient's face anatomy allows and you can get a good seal around their face. You're going to use the adult mask the exact same way. They do have pediatric masks that are a little bit smaller than this, and so if you have access to that, of course use it. If you don't have access to it and you cannot create a good seal using the adult mask, all we're going to do is flip the mask upside down, and now we're going to have the wide part closer to the forehead, and then the narrow part will go closer to the chin, and we're just going to cover up that kid's entire face. And we're still going to use that CE method. Use our C right on top of the mask, use our E, lift the chin up, and do 2 just little tiny breaths, just enough to see the chest rise and fall. And that'll be it. You're still going to check to see if they're unresponsive initially the exact same way. Feel for a pulse, look for breathing. Not a whole lot really changes for kids. For that 1-ish to 15 years old-ish, nothing really changes too much. Depending on their size, if they're on the smaller size, if their body's on the smaller size, their head tends to be a lot bigger compared to that body size. So what we can start to consider is raising up the shoulder blades, raising up the chest, just to drop the head back a little bit, to open up the airway a little bit better, because when they're laying down with their big old heads, they're pinching off the airway. So now, raise the shoulders up, and it's just going to drop their head back, open up the airway a little bit. So it's just going to open up, raise their shoulder blades, You can use a couple different things. You can use like a towel, a blanket, roll up their shirt, roll up their sweater, and just right underneath the shoulder blades. They're going to be laying on their back, so right underneath the shoulder blades, only lift it up about an inch or so, and that's going to be all you need to do. The AED placement, you can still use the adult pads. Depending on the kid's size, you still might place them the exact same way you would an adult. You know, that left lower chest and the upper right chest below the collarbone. So then it would still look something just like this. Now, if the kid is on the smaller size and these AED pads start getting too close together, and too close is going to be about 2 inches away from touching each other. So something like this little gap here is only about an inch or so. So within about 2 inches of each other from touching, the electrical current will not flow through the heart how it needs to, so this positioning is not going to work. So what we're going to do in that instance is we are going to rotate the pads to the right, and it's just universal, pads rotate to the right. And what I mean by this is the one that's on the right shoulder, the right pec area, is going to rotate to the right, to the center of the back, and then the one on the left lower chest is going to rotate to the right, to the center of the chest. And now we're just going to sandwich their body just like that. Alright? And that's it. That's really going to be your only differences when it comes to this like adolescent 1 to 15-year-old size. So now let's talk about infants, babies, that 0 to 1-ish years old. These guys, treat them like a kid. All the same stuff is going to apply. Still 100 to 120 chest compressions a minute. Now we're going to go down about 1/3 of their body depth. Sorry, my camera cut out. So, I don't know where we left off. Divide their body into thirds or compress about 1 inch to 1.5 inches deep. Still that 100 to 120 chest compressions a minute. If you are by yourself, you're going to use that ratio of 30 to 2. If you have help, you're going to use 15 to 2, and that'll be your ratio. Babies, infants, have freaking massive heads compared to their body. So now we are going to have to raise up those shoulder blades to drop that head back to open up the airway a little bit better. And use their little spit up blanket, their spit up towel, use a little blanket, use their shirt, roll that up a little bit, just enough to raise their shoulder blades up. Only about an inch or so, nothing crazy. I'm going to go backwards just a little bit here to check if these guys are unresponsive. Well, to check if they have a pulse and breathing, we've already determined that they're unresponsive. We're going to sit there, we're going to hit their feet, flick their feet, see if they're going to be responsive to that. If they aren't, we're going to feel for a pulse. Now we're going to feel for what's called a brachial pulse. And you're just going to go in between the bicep and the tricep. You're going to press down, grab their little arm, and feel for a pulse there for no longer than 10 seconds. While this is happening, look at their chest. Really look at their stomach. See if that thing's moving when they're breathing. If you don't see that, their stomach or chest moving when they're breathing, or they're not breathing, and you don't feel a pulse, they're pulseless, they're apneic, we're just going to start that whole process of CPR. So now we're back where we left off. To do CPR on a kid, on a pediatric, on an infant, we have a couple different ways to do it. We can either use our 2 fingers, so you're going to take 2 fingers, place it right on the center of the chest, in between the nipples, and we're going to do our compressions. Or we can use our thumbs, so we're going to wrap around their body, and this is the preferred way that I like to use, because now I can like hold onto their chest, hold their ribs, I can feel if they're breathing at all. And then my thumbs are a lot stronger than my 2 fingers. So now we're just going to use our thumbs and just do our chest compressions. And we're just going to push right into the center of their chest. We're still going to have them down on a hard surface. And I'm by myself, so I would do 30 compressions and then 2 rescue breaths. To do mouth to mouth on these guys, you're not going to pinch their nose this time. You're just going to wrap your entire mouth around their nose and mouth. And just 2 really tiny breaths, just enough to see that little chest rise and then fall back down to that normal position. you can really pop these guys' lungs, these little babies' lungs. So really be cognizant of how much breath you're giving them. They don't need a whole lot by any means. If you're working in a hospital or you have like this little mask here, um, this isn't the preferred way. Hopefully you have like a little infant size and this bag will be a lot smaller and this mask will be really tiny just to fit on these faces better. But let's say we don't have that. Let's say we only have something like this. We're going to flip that mask upside down. The wide part is going to go over the forehead. The narrow part is going to go on the chin. We're going to cover their entire face. Use that CE method. Press down a little bit, lift the chin up, and just 2 really tiny breaths, just really small. Just enough to see the chest rise and fall. That is all we're doing. And then, if we only have an adult AED pads, they're just going to go front and back. So rotate to the right. The one that should be on the right shoulder will go to the center of the back. The one that should be on the left chest will go to the center of the chest now. And we're just going to go ahead and sandwich their body, just like this. And that's all it's going to do. That's all we're going to do for them. Still have the AED on. You're going to place it on bare skin, like with everybody else. And we're going to listen to what the AED says. You might have little pediatric pads just like this. They have to be placed front and back. So you'll just do what it says. There's little pictures on them showing the front and back position. So there's really no confusion on how to place these pads. And so that's really it for like the 0 to 1-ish years old. That's basic BLS CPR for these guys. Now, a couple things I want to add. If you have an adult man and he's really hairy, and a lot of these AEDs, they're either going to come with a second set of pads or they might come with like a razor blade, like a shaving razor blade. And you're just going to shave 2 little squares off to where you can get bare skin in the correct positioning, and you're just going to go ahead and shave them. Shave little squares, doesn't have to be perfect. Don't worry about nicking them. Just get, just bare skin. If you don't have a razor, but you have 2 sets of pads, you're going to take 1 set of pads, you're going to place them exactly where you want them to be, get them nice and firm on there, and then we're just going to rip them off. We're going to wax the hair off. And then we're going to take our brand new set, our clean set, and place it back in those positions. And now we're good to go. We'll start doing our CPR and listening to what the AED says. If you have somebody who's wet, if they drowned, if they were in the sauna or at the gym, all we're going to do is we're going to dry this person off. We're going to get their wet clothes off. We're going to dry them off. You can do anything, right? But you shouldn't shock a wet person. So, dry them off. If you can't dry them off, don't use the AED. If you can't get this person away from that wet environment to where they're not in a puddle, don't use the AED, and this goes for snow as well. While you're doing your chest compressions on somebody who drowned, maybe turn their head probably away from you, but just turn their head and do your chest compressions and let that stuff just drain out. Let any water that's in their mouth just drain out while you're doing your chest compressions. If you have somebody who's pregnant, a pregnant mom, and they're in cardiac arrest and you have the help, somebody's going to be doing that BLS CPR while somebody else is going to be pushing the fetus off of the center of the body, off of the aorta that runs along the spine. And you're just going to get in there and you're just going to push, just a firm pressure, push that fetus off the center line and push it off to the left. And that's what you're going to do for them. If you have a really obese person, really big person, really hard to do chest compressions, try to get somebody stronger to do those chest compressions, or just do the best you can. Chest compressions are going to be the most important thing, so do the best you can. Even if you can't do any rescue breathing for this person, that's okay. Do the chest compressions because you're helping. Even calling 911 is doing enough. That's helping. Coaching somebody else how to do CPR if you can't bring yourself to do CPR. that's helping. Anything you can do to help this person is beneficial for this person that's in cardiac arrest. Now, we're just going to get a little sad for a little bit, okay? Cardiac arrest, this person is dead. With that being said, the worst thing that could happen to this person has already happened. This person is dead. You're not going to hurt this person. You might hear crunching sounds, breaking sounds. This could be the ribs breaking, but it's probably going to be the cartilage in between the ribs and the cartilage that connects the sternum to the ribs. You're going to be breaking all that stuff up. You might be able to hear it. You're probably going to feel it. And the first 10 or so chest compressions are going to be the hardest physically. But after that, it's going to be real easy because you just broke everything up. But that is okay. That is a normal thing to happen. Don't be alarmed by this. While you're doing your CPR, you might see vomit coming out the patient's mouth. You might see blood coming out the patient's mouth. This is going to be a normal thing to see. So don't be alarmed by that either. Don't really be scared about hurting this person and breaking stuff because they need to be alive to heal. So let's do everything we can. Let's do the best that we can to make them come back alive, right? And they aren't, if you get a pulse back, they're not just going to jump up and be alive. They're not going to start talking to you. They're not going to start looking around. They're probably still going to be unresponsive. They're going to be unconscious, but they'll have a pulse. They might not be able to breathe too good on their own. So you're just going to have to breathe for them. And you're going to breathe for them one breath every 5 to 6 seconds until the ambulance shows up to help. And we're just going to do the best we can for this person. Somebody in cardiac arrest, they might pee on themselves. They might poop on themselves. This is also going to be a normal thing to happen. So don't be alarmed when you start seeing this stuff. So that's essentially it for cardiac arrest. Now let's talk about choking a little bit. So choking, you're sitting down at a restaurant, you look across the room and you see somebody do that universal choking sign. You're going to tell somebody, the people you're with, hey, call 911, and then you're going to walk over to that person. Once you get over to that person, you're going to ask them a question that they don't want to be asked. And all it's going to be is, hey, are you choking? And they're probably going to, something like that. So, if they're able to make any sound at all, that means that the object is not completely blocking their airway. So, we're just going to ask them to cough. So just tell them, hey, cough as hard as you can for me. Forcefully cough for me. While they're coughing, probably don't stand in front of them, right? Maybe start walking behind them and get ready to do the Heimlich maneuver. Now, how we do the Heimlich maneuver is we're going to take a fist, we're going to ball it up, and we're going to place it in between the belly button and this little triangle piece here. The xiphoid process is what that thing is called. Or just the belly button and the base of the ribs. And we're just going to ball up a fist, place it there, hold them tight with you, take your other hand, wrap it over that fist, and we're going to make a J shape. So a scooping, just J shape. You're going to take the bottom portion of your fist and just scoop it into them, scoop it into the patient. And there's no depth measurement, there's no rate measurement. It's just as hard as you can for as long as you can. And you're just going to back it up, back it up, back it up. And you're going to do that, again, as hard as you can for as long as you can. What we're doing is we're essentially trying to knock the wind out of them. We're trying to hit that diaphragm, spasm that diaphragm, make it push the air out of the lungs, and hopefully push that object out of the trachea. What we don't want to do is what everybody does when they think somebody's choking, and that's just walk over and start patting somebody on the back. All we're doing when we're patting somebody on the back is vibrating that object. And if somebody's standing up or sitting up, you're just going to vibrate that object towards gravity and vibrate it, further down the trachea. So the coughing and the Heimlich are going to be the best bet for these people. If the person that you're doing the Heimlich on becomes weak and unresponsive, we're going to assist them down to the ground, and we're going to do our chest compressions. We're going to do 30 chest compressions, and then we're going to do our head tilt chin lift, but instead of doing 2 rescue breaths, we're going to look in their mouth. If we see the object in there, we're going to go in with a finger, scoop the object out, use our 2 fingers, pull the object out. If we do not see the object, you can't see the object at all, we're going to go ahead and do 30 more chest compressions. After that 30, go back to the mouth, see the object, scoop it out. Don't see the object, go back to your chest compressions. We are not going to do a blind finger sweep. We're not going to stick our finger in there and just try to search for something that we can't see, because we might just push that object further down the trachea, and then it's just going to be harder for that object to come out. And so you're just going to do that. At this point, it wouldn't be a bad idea to have an AED. Get that on just because you have it, just because you can. But we're not going to do any breaths until we know that object is out. And we have 911 coming, so they're going to be able to take over and hopefully get that object out. Now, for kids, for that 1-ish to 15 years old, or that standing age to 15-ish years old, we're going to do the same exact stuff. If it's a smaller kid and they're choking, we're going to get them standing up on a table to do the Heimlich maneuver, or we're going to get down on our knees to just line ourselves up to their body just to do our Heimlich maneuver. We're still going to make that scooping, that J shape, in between the belly button and the base of the ribs. We're going to do it for as long as we can, as hard as we can, until that kid goes unresponsive or until that object comes out. If the object comes out, we're going to stop doing our Heimlich. If they go unresponsive, just like the adult, help them to the ground, do 30 chest compressions, look into the mouth. If you see the object, pull it out. Don't see the object, back to chest compressions, and you're just going to bounce between those 2 things until that object comes out. Now, for little babies, that 0 to 1-ish years old, we're not going to do the Heimlich on them. What we're going to do is we're going to do 5 back slaps and then 5 chest thrusts. The 5 chest thrusts are just going to be 5 chest compressions. Now, the way we're going to do this is we can either sit down or we can stand up, just whatever you prefer. We're going to stabilize their head. I like to grip their chin just so their head's not flopping around while I'm moving them around. So grip the chin, grip the cheeks, cradle them in your arm, face down. You want them angled down slightly towards gravity, braced in your arm, kind of like a football. We're just going to do 5 back slaps with the heel of our hand. And then we're going to take them, cradle the back of their head, rotate them over, angled down towards gravity. 5 chest compressions. After those chest compressions, we're going to look into the mouth. If we see the object, pull it out. If we don't see the object, flip them back over. Do 5 more back slaps, flip them back over. Do 5 more chest compressions, look into the mouth, see the object, pull it out. If you don't see the object, back to the back slaps. And we're just going to continue with that process until this baby goes unresponsive or until the object comes out. If the baby goes unresponsive, we're going to help them down to the ground or down to a table. And we're just going to do chest compressions. This time, we're going to do our 15 chest compressions. Look into the mouth after those. See the object, pull it out. Don't see the object, back to our chest compressions. And we're just going to bounce between those 2 things for the entire, resuscitation attempt, essentially. And that's really it for choking. Let's say you have somebody who's pregnant, or you have like a really obese, a really big person that you just can't wrap your arms around. What we're going to do then is we're going to get as high up on the belly as we can, right below the base of the ribs. If you have to go onto the ribs, we're going to do the best we can, but we're just going to try to push back from behind them into that area. Avoid the baby down here if it's a pregnant mother. If it's a really big person, do the best that you can, wrap your arms around. That's really all we're going to talk about in this video. If you guys have any questions, comments, concerns, place them down in the comments. If you want to sign up for a course, send me an email. But yeah, that's it for this video. Thanks for watching. See ya.